right, that's fine. We can start.
Okay, give me a second. I'll start your timer for 10 minutes.
Okay.
Okay, you can start now.
Hi, my name is Anam and I'm one of the doctor in the cardiac clinic today. Is it Mrs. Jennette, 70 years of age?
I'm Mr. Adam.
All right, Mr. Adam, are you the next of kin and son to Mrs. Jennette, 70 years old?
Yes, I am.
All right, nice to see you today.
Nice to see you
So,
too.
Mr. Adam, today we are going to talk about your mother's health condition and her management plan moving forward. Is that all right?
Yes, that's fine.
All right, to begin with, I just want to know that how much you know about your mother's condition and her management plan.
Yeah, so I'm not really sure, doctor. I got a call this morning that I need to bring my mother to the hospital today. There has been some kind of mistake. I'm not sure. As for her condition, yeah, I know that she had some heart condition a few years back.
All right, Mr. Adam, I appreciate your knowledge about your mother's condition. And I just want to know that what are your expectations from today's meeting?
I just want to know why I was called this morning. I'm kind of worried.
I completely understand, Mr. Adam. It must be a very difficult time for you, and you might be expecting something. So, Mr. Adam, as you rightly mentioned, that your mother had some skin procedure done, and in light of that, her ICD, the cardiac device that she is having, was turned off, and we should be turned on discharge. It is the normal practice to do that. But I have a concerning news for you. Is that all right?
Why was it turned off?
Sorry, my
It's okay.
thing just
I'll
broken
pause your
up.
timer. So would you be able to continue or?
Yeah.
Okay.
So, Mr. Adam, as we discussed that your mother had a procedure for skin condition, and it is a protocol and it is a guideline to turn off the ICD during the procedure for any skin condition.
Okay.
So, in light of those, we rightly, switched off your mother's ICD, the cardiac device. And usually, after the procedure, usually it's the practice that once the procedure is being done, we need to turn it on.
Okay.
But unfortunately, in your mother's case, an error has done from our side. Unfortunately,
What do you mean, doctor?
that we unfortunately failed to keep the follow up, and we forgot to turn on his cardiac device on discharge. I'm really
Oh
sorry for
my
that.
God. You cannot be serious. So all this time her device was just sitting there in her heart and not working?
Yes, Mr. Adam, I'm really sorry for that. I can completely see that you're
If I'm
very
not
upset
wrong, that
regarding
that
this.
could have proved fatal, right? She could have died.
Unfortunately, yes. If because she's having underlying cardiac condition, heart condition, and this device is very important for her. But unfortunately, an error has occurred from our side, and it can lead to some concerning results.
Oh
I'm
my
really sorry
God.
for that.
This you just called it an error. I think it's criminal negligence. Who's responsible for this?
Mr. Adam, I can clearly see that you are quite upset. I'm really sorry for that. Anyone at your position could have reacted in the same way. But let me tell you that we have already taken the relevant precautions for that. And as you ask that who has done this thing, we work as a medical team together, and any error happened is it would be like labeled as a medical error, and it will be done by a medical team as a whole, not a single person.
So that means you all of you are responsible. So should I take you to court as well?
Unfortunately, we all are responsible for this, but let me reassure you that we have already taken few measures, and we have already escalated this to our consultant, and we have already escalated it to the relevant person who is responsible to keep the follow-ups, and our nursing in charge also.
Oh my God.
And we are going.
So what else have you done except just talking amongst yourselves?
We have done the what we call incident report.
Yes.
Already forgotten.
Yes, that's right. Okay.
So we have already,
So what do you mean? You're just reporting amongst yourselves. First of all of you are responsible. So you're just talking amongst yourselves.
yeah,
The criminals don't investigate themselves. So what's the point? I want to know
yes,
who's.
that's quite, yeah. Yeah, Mr. Adam, I'm really sorry for that, but let me reassure you that we have already write an incident report for this thing, and we have already mentioned everything and all the incident that happened in your mother's notes, and everything will be, look into the bottom, and we will try to sort this thing as soon as possible, and we have taken all the necessary action. And don't worry, we are with you in that, and we will investigate this thing till bottom, and we will make sure that this thing does not happen in future. And furthermore, we are going to refer your mother as soon as possible to the cardiac unit, and we are going to turn this thing on, and we will make sure that it works properly, that when we discharge her home back.
And what if I want to complain?
Definitely, it's your right to do the complaint, and we do have a proper system and office for that we call patient advisory and license.
Dr. Anam, can you unmute yourself?
Yes, sure.
Okay. So I'm going to restart your timer where we left off. You have 3 minutes remaining. Okay, you can continue from there.
Okay, so Mr. Jain, as we discussed that we have already escalated this mistake to our consultant and the nursing in charge. We have also written the incident report for you, and we will make sure that we will follow this, and we will reach the bottom of this complaint. Plus, as you mentioned that you want to complain formally, then we do have a proper services for that we call patient advisory and license services. So after completion of this consultation, I'm just going to refer you to there, and you can write a formal report there, and we will follow your report, and we will make the appropriate changes in our department, and we'll make our system of referrals and follow up more appropriately. Furthermore, I'm just going to refer your mother to pacemaker department, and they are going to restart your mother's pacemaker, and we will also do field investigation like ECG of her heart, and we will also do the full set of her observation to see the heart rate, and we will make sure that before discharge she will be perfectly all right.
Okay.
And I'm again very sorry for this what happened. I'm really sorry for that.
So how long does it take for my complaint to get registered, and how long will it take for any action to be done?
So that's a quite right question. I'm just going to refer you to PAL services. They will report your complaint as soon as possible, and further follow-up and further time span will be told by them.
Okay. And can you please tell me, next time I just want the heart specialist to see my mother, no one else, just the senior doctor.
For that's the senior doctor. Mr. Adam, that's quite a valid concern, but let me tell you that we don't have consultants here all the time. We have a proper referral system to follow that. First of all, our junior will see you in detail, and then we can always ask for a consultant for help. So I can't promise you for that, but I will make sure that whenever your mother come to hospital, she will be attended in a right manner. But I can't promise that every time consultant will be available to see her. But we can definitely do an appropriate referral to a consultant clinic for her if required.
Okay, that's fine. And doctor, let me know. What are you going to do with the person? Once the investigation is done, what will you do for the person who's responsible? And according to you, it's all of you. But what's going to happen?
Mr. Adam, basically it's a medical error, and it can happen from anyone. So it will be decided by the PALS team that what type of error is it, and what actions we can take on that.
I can tell you what type of error it was a crime against my mother. She's 70 years old, and you just let her go home. She could have died. You just admitted that she could have died. So I don't think we need anyone else to tell you what kind of error it was.
This quite genuine concern, Mr. Adam. Anyone at your place could have felt the same way, but this thing will be answered by the PALS team.
Where's my mother right now?
Yes, your mother is in cardiac ward at the moment.
Okay.
We are going to keep an eye on her, and we will make sure that before we discharge her, she will be perfectly fine.
Okay.
Is that all right?
Yes, that's fine.
Do you have any other concerns, Mr. Arun? I can understand it's very difficult time for you and it's very concerning for you. I'm really sorry for that. Once again.
And that's fine, doctor. Okay, your time is up. Really sorry for the disturbance, and thank you everyone for your patience. So, Dr. Anam, how did you do? What do you think?
Um, I think it was not like fairly a good like performance of mine, but
Done better, in your opinion?
I think I could have like make proper notes before that, and at the end, I don't know that what steps we are going to take against the doctor or medical team. I was not aware of that.
Okay.
Plus, as soon as possible, as soon as a patient complains regarding anything, we need to know that we need to escalate to consultant and nurses. And first thing first, we need to mention incident report.
Yes, yes.
That's very important. And even if patient doesn't like mention regarding powers, we should also offer that too. Because in this case, I think we are the like culprits, so we should be like handle answerable.
Okay, let's discuss this from the beginning. Okay, so when you're outside, when you have 5 minutes, write down your role and the patient's name and who you're going to talk to. So the first mistake you did was you called him Mrs. Jennette. Obviously, when there's a surrogate, in the actual exam, you'll know that it's Mr. Adam or Mrs. Jennette. But regardless, you should know who you're addressing. Okay, so the first thing that comes out of your mouth puts a very major impression on the examiner as well as the surrogate. Okay, he can get angry at the first thing if you address him by the wrong name. Okay, so the first thing is addressing the right person with the right name. So the first thing you called him Mrs. Jennette. Okay, so the next thing you mentioned that you're in the cardiac ward. So cardiac is a medical jargon, and you used cardiac around 3 times during the consultation. Okay, so what I suggest is don't use if it's mentioned nephrology, cardiac, whatever, don't use it. Not even the layman version of it. No need to say I'm in one of the doctors in the heart ward. You can say I'm one of the doctors in the ward today. If you practice like this, you'll be fluent and you don't need to think much about it. Okay, and it's not going to deduct any marks. So there's less margin of error or mixing things up. So you can just say I'm one of the doctors in the ward today. Okay, so you did the next step, ideal step, is to ask the surrogate what he already knows about his mother's condition. So that was the correct approach. He's going to tell you. If he says that I'm unsure, I don't know what my mother has, then you need to explain him that she had a heart arrest 5 years ago and there was a device that was placed. But in these cases, the surrogate already knows about this and they won't waste your time. So he will be aware that her mother had a heart condition, she has an ICD in place. Okay, so the next step is the addressing the diathermy part. The patient asked you why was the ICD switched off. So diathermy or cautery, anything like that, they can interfere with the ICD's electrical pacing and basically the shock given. Okay, so how you can explain it to the patient or the surrogate is during her skin procedure there's an instrument that is used that can interfere with the heart's normal rhythm. So it's standard procedure to turn it off before the procedure, and once the procedure is done we turn it back on again. Okay, so that's explaining that why it was switched off in the first place. So it can interfere with the electrical activity of the device and the heart, so it risks abnormal rhythm of the heart. Okay, so the rest was fine. You didn't mention that it's standard procedure. Okay, so once you've explained this, then mention in the same go that unfortunately the device was not turned back on again and she was discharged. Take a pause, the patient is going to react and then apologize again. So your tone was okay, you apologize in the right manner. A bit more fluency is what is needed. You called her mother his. Okay, it's not a very big mistake, but don't mix up pronouns either. The next thing is the patient, the surrogate is going to really react angrily that she could have died. You have to admit there's a duty of candor, or also known as a duty of honesty. We owe all our patients and their family members the complete truth. We cannot hide anything. Okay, so it's really important to be very transparent. Admit that yes, that was a massive oversight on our part. It could have been it could have led to complications and even death. Thankfully it was caught in time and we called you to the hospital so it could be turned back on again as soon as possible. Okay, then let the patient talk. While he's talking, try to just nod politely, and listen to what he has to say first. I know we have this in mind, especially when we practiced cases really well. We have a format in mind that we have to mention the incident report and the pals and everything. So in that case, we try to rush into mentioning all those things. Try to pace yourself with the surrogate, because he has a script to follow too, right? So it would be more natural if you listen first and then answer. And since there's a separate skill of addressing patients' concerns, you'll score more if you just listen to what he has to say. He might have a lot of questions. So uh, pace yourself with the surrogate. Okay, he's not going to go on and on, because they have a very limited script and they cannot just blabber on, if so let them talk. Okay, so the next thing is, he had very specific concerns. So was it turned off? So I mentioned it can interfere with the heart's normal rhythm, and it's standard procedure to turn it off. Second thing is, who who is responsible. So I know many of the mentors discuss that the right thing to say is, we are all responsible as a team. But sometimes this is not the case. Okay, for example, in this case, the whole team cannot be held responsible. Obviously the treating team is looking after the patient, but there's only one person who was responsible for this, although the point is not to point him out. But the right way is to say that, unfortunately I'm not aware of this, and if you allow me, we can look into the matter and we can get back to you. Rest assured that we take these matters very seriously, and this incident will be investigated, and for that we have already written an incident report. Okay, so you kind of like, answer his concern and then go on to your agenda. That was the incident report. You don't take the blame for the whole team, and you just make sure that the surrogate knows that you've already done an action. So your words will seem empty if you don't follow up with something that you've done. Okay, so actions are really important. So mention that we've already written an incident report, we've already informed the consultant, who is the senior doctor in charge of taking care of your mother, or in charge of the treating team. Okay, so in any case of error, smoothly glide into the incident report part, informing the consultant, and doing another action, that is to fix her mother's condition. So you can say, we've already informed the heart specialist, and he will be attending your mother and reactivating her device. Okay, so again, you use the word, she's in the cardiac ward. So no cardiac, only heart. Okay, next, you at some point you call Mr. Adam Mr. James. I'm not sure why. So please be really careful with the names. Okay, avoid saying names if you have any confusion, or if you've forgotten. Okay, and the thing, you called it pacemaker at one point. So there is a difference between ICD and pacemaker. So be very careful. Read the scenario carefully and don't deviate. Use the words mentioned in the scenario, and or if you've forgotten what the scenario was, use the terminology that the patient or the surrogate is using. Okay, or avoid using those terms. If you've forgotten it, if it was an ICD or a pacemaker, don't use the term. Say the device, the heart device. Okay, so be really careful. It's okay to make mistakes and forget things, but you should know how to be careful. Okay, so what else he had another concern. Where's the senior, where's the cardiologist? So you address that in the right way, that it's not possible for him to be available all the time, but it's really important to emphasize on the positive aspect of it. You can say that, I can understand your concern. You would want your mother to be seen by the senior. Unfortunately, he cannot be available at all times, but rest assured that we are in contact with him, and he is in charge of taking care of your mother. And if at any point we feel that she needs to be attended in person, we'll try our level best to inform him. Okay, so you're kind of like, what to do next with pals. Okay, I'll tell you. So the cardiologist concern, or the senior concern, in any case is, acknowledge what he's saying, that you can understand that you would want your mother to be seen by the senior. Unfortunately, it's not possible, and then sandwich his concern with two positives. Okay, so you end with another positive, that rest assured that he is well informed about your mother's condition and her progress. Okay, so at the end, it doesn't leave a bitter aftertaste or anything. So kind of sandwich the negative part with the positives. Okay, so pals, when he says, Okay, you mentioned offering PALs or complaining even if the patient doesn't. So I'm not sure what the right approach is. Mostly the surrogates are given a script and they always mention if they want to complain. The right thing, I don't think they're looking for doctors who would guide the patient towards lodging a complaint. They wouldn't want that. So I don't think it's the right approach to offer getting them to complain by yourself. If you wait, they're going to ask about it. Okay, so I won't suggest suggesting complaining first. Okay, when the patient asks how long will it take for PALS to investigate, so PALS usually takes a few weeks. There's no definitive time, and you answered that well. So just an estimate is it can take up to weeks. um, 2 weeks as in like a couple of weeks, or maybe more. So answer in an estimate, not an exact duration. Sometimes the surrogates might ask that they want to they're not trusting PALS because it's part of the NHS, and the surrogate was already skeptical that you're part of the same team. All of the crimes and the criminals are bunched together, so they might want to independently investigate. So there's another investigating authority. It's called ICAS. So that's Independent Complaint Advocacy Service. They wouldn't expect you to know, but if the surrogate somehow asks, you can mention this as well. So they can independently get an investigating body to investigate the incident. Okay, so again, the format in any case of medical error is listen to what the patient has to say. ICAS is Independent Complaint Advocacy Service. Independent Complaint Advocacy Service. So, okay, so the format is listen to what the patient has to say. What does he already know about the condition? Fill in any gaps that were already given in the scenario. Then start to go, breaking the news, mentioning what happened. Start by kind of recapping what happened. Like in this case, she was brought in for her skin procedure, and kind of like telling a story what happened and what led to what kind of events. Unfortunately, she was discharged without the device being reactivated. Okay, then give a pause. The patient is going to react. Sometimes he can be confused. He wouldn't be sure if that's a big thing. You can apologize and say, unfortunately, there has been a massive oversight on our part, or there has been a mistake on our part. The device should have been turned on, but rest assured that fortunately it was seen and detected at the right time, on time, and she was called back again. Next thing, let the patient talk. He's going to react in an extreme manner. Could be anger, could be denial, could be anything. So just wait, let him respond, and then say sorry again. Acknowledge his feelings. I see and I can understand how you must be feeling, or I can only imagine how you must be feeling right now. And then go on about the actions. We've already written an incident report. This will be investigated. We have informed the consultant. We have let the nursing manager or the nursing in charge know, and then address his concerns. At this point, he will have a lot of questions, so your main target should be addressing his concerns. Any other confusion or something that you'd like to ask? In any case, not just this.
Yes, Dr. Namin. So, if he asks that what pause is gonna do with that person, then what should be the answer?
Yes. So, okay, that reminds me of another thing. So you're going to say that they're going to investigate. I'm very sorry that I'm not the right person to tell you what would be done with the responsible person. But rest assured that we take these matters very seriously, and the outcome will be reported back to you once PALS has investigated the matter. Okay, so you're just basically saying a lot of nothing. You're saying that you're unaware because that's the truth. You're not the right person to answer this. You're going to hand him over again to PALS and reassure him that whatever will happen will be reported back to him. The outcome will be reported back to him. Another thing, what's in our hands is tell him that we're going to do some frequent teaching sessions uh, to make sure that that such kind of incidents don't occur again. Okay, so what you or your consultant or your team can do is hold teaching sessions or monthly meetings in which this incident will be discussed, so you can avoid any future occurrences. Okay, so if I mark you according to the RCP criteria, your clinical communication could be borderline, and in some cases, maybe some examiners might mark you unsatisfactory because just because of the jargons. Okay, cardiac and mixing up ICD and pacemaker and mixing up the names. Clinical judgment is okay because you did the right thing. You mentioned that the incident report, pals, reactivating her device, making sure that she's observed and she's fit to go home. All of this is perfect. If you had more time, at the end you can add any alarm signs, as safety netting. You can tell her if she feels dizzy or giddy, or if there's any concern, if there's anything, they can refer to the emergency or get in contact with the hospital. Okay, just a safety netting at the end if you have time. Patient welfare is okay, that will be satisfactory. Addressing concerns, you address all his concerns. There were almost 4 to 5 concerns and you addressed all of them. Okay, any confusion, anyone, or any questions regarding communication in general?
Yes. Dr. Namin, would you able to tell me that how should we differentiate between the error and the negligence?
Okay, so
Would it be mentioned in the scenario, or we need to
yes, so in some
judge
cases,
it?
in the formats, in the scenario, it's written problem medical error. Okay, in some cases, in
Okay.
some cases it might not be. Okay, so medical negligence or medical error, it doesn't really make a difference. Okay, the approach will be the same. Negligence is really uncommon in the exams because negligence means either the mistake was intentional or there was a loss of life or limb, anything more serious. Okay, so in PACES, medical errors are more common. I think I've only seen one case of negligence. I'll share that in the group. I can't recall the exact scenario. It was something along the lines of a patient with I think metastatic skin cancer that eventually led to amputation of his hand. So that was a case of medical negligence. Otherwise, PACES only has medical error cases. Okay, either way, the approach would be the same. You still have to apologize, admit, and do the same, steps.
And as you mentioned during the scenario that I will take you all to the court and stuff like that, then how should we respond that?
That's just a patient getting angry. You just listen, say, apologize, and then mention all the actions that you're going to take. So
Okay.
it was because you kind of like took the blame for someone else's mistake. So that's why I don't suggest
Hmm.
saying that we all are responsible. Don't use this
Hmm.
statement. So you can avoid some.
Okay. All right. Okay.
Okay,
Thank you.
you're welcome. Can you repeat about the monthly meeting thing? Okay, so these are basically morbidity and mortality meetings, M&M meetings that are held. So you don't need to use this term with the patient or surrogate. Just say that we will hold some frequent teaching sessions, or we're going to hold a monthly meeting in which this incident will be discussed so we can avoid any future occurrences. Dr. Day asked when she will reactivate ICD if tells. I'm not sure what you're asking. If you could repeat your question.
Doctor, actually, it's so good tell doctor.
Mm-hmm.
So when the ICD can reactivate to my mother, if she though he's fine now, okay,
Hmm.
he's not have
Dr. Day, if you could repeat, your voice is breaking off.
hello,
Yes, yes. Please continue.
hello.
Yes, I can hear you.
If if surrogate tell that, so when reactivate the heart device to my mother's,
Mm-hmm.
when he will reactivate the ICD device, that is heart device to my mother. Though he's doing good, right now he has no problem.
Mm-hmm.
Okay.
Okay, so he's
So
asking
when so what to say at this time?
if he's asking when will the device will be reactivated, or if he's saying she's fine now, so no need to reactivate. I'm not sure I understood your question.
Actually, I want to say actually the device is deactivated.
Mm-hmm.
That means the heart doctors is failure to reactivate the device before
Hmm.
discharge the hospital,
Hmm.
isn't it?
Yes.
Isn't it?
Yes.
So, but basically he is doing good. He's
Hmm.
not right now. He has no problem.
Yes.
Okay.
Yes.
So it is need to be reactivate again,
Ah, okay. I got
isn't
the
it?
question. Yes. So you're going to say, thankfully, fortunately, the mistake was caught early, and fortunately, she did not experience any ill symptoms or any alarming signs. But it's really important that she has the device reactivated again, considering her heart arrest that she had 5 years ago. She is currently at a very high risk of experiencing abnormal heart rhythms and experiencing another heart arrest. So it's very important to reactivate the device again. Okay, so the time period is really short. She had a surgical a skin procedure, and it was caught on the error was caught early. So that's why a long time didn't lapse. And even if it did, she is already 70 years old, had a cardiac arrest a few years back. So you need to counsel the patient that she is high risk, and the heart specialist is of the view that she needs the device to be reactivated to avoid any complications. It can lead to abnormal heart rhythms. Dr. Iza asks, if the patient says who is responsible, I need the name, how do we respond? Okay, so since in the scenario doesn't mention who was responsible, so we actually, in truth, we don't know who's responsible, right? So you're just going to say, I'm very sorry, I'm unaware, but I can look into the matter and let you know. Rest assured that we've already written an incident report and this matter will be investigated. Okay, so the investigation will be done. Of course, the responsible duty doctor will be investigated. He's going to tell his side of the story, and this will be then taken to PALS. It will be investigated. uh, at most, it will be discussed in the monthly meeting, and they're just going to say, take measures and discuss what can be done to avoid any future occurrences. So it's possible. It's not the part of the scenario. I'm just discussing what actually happens. So practical measures are taken so it can be avoided. Maybe there will be another senior who's going to cross check all the discharges he makes for some time till he's considered competent enough. So don't mention any name in case it's mentioned. The scenario will never ever mention a name. Okay, even it, at most is it's just going to mention the junior doctor in the ward discharged. Okay, so you're not going to name any names. You're just going to say, I'm unaware, I'm going to look into the matter, and write an incident report. The matter will be investigated and the outcome will be reported back to you. So if at the end he doesn't want an actual name, he's not going to do anything with the name. He just wants someone to complain against, right? So we're already guiding him to the right path, to PALS. He doesn't want to hear a name, he just wants someone to complain against, so PALS will do that. Any other question about errors or any other confusing scenario that you've read that you'd like to discuss? In the exam they're just I don't think they're really carefully listening to all communication. They just want a good opening, a good ending. As long as you're using the right keywords, using the right tone, the right body language, since it's an error case, so your tone should be low. You should sound a bit empathetic. You should sound sorry. You need to be sound believable that you're actually sorry and not just reading a well rehearsed line. You shouldn't be sitting with your legs crossed, not with your arms folded. When the patient is talking, you shouldn't be rolling your eyes or looking elsewhere or at your notes. Okay, these are little things, but they matter a lot. Also, there is another difference. For example, if it's a procedure explanation, you need to explain a disease or a procedure. At that point, your tone should be confident, and in such cases or in breaking bad news, lower down your tone. In communication, they have an answer key. Okay, basically they're just taking off some things that they want to hear. So in clinical communication, the clinical communication skill, please don't use jargons. Be very polite with the patient. Do not react angrily. Do not sound defensive even. Do not refute anything the patient says or the surrogate says. Okay. Everything, anything they say, start with yes, I can see, I can imagine what you're going through, and then continue with your agenda. Any other questions? You're welcome, Dr. Anam. If there are no questions, I can end the meeting. I'll try to do another session on LCC in the coming week. You're welcome, doctor. Okay, if there are any questions, please feel free to write down in the group. Okay. Thank you, everyone. I'm going to end the session now.